What does informed consent for Cariprazine, otherwise known as Vraylar, look like? My name is Dr. Reed Sutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Cariprazine because I've gotten the request for this a few times. So Cariprazine is an atypical antipsychotic. It has a mechanism that's kind of similar to aripiprazole, otherwise known as Abilify, in that it acts as a D3 and D2 partial agonist. So those are two of our dopamine receptors, as well as a partial agonist at the 5-HT1A receptor, which is a serotonin receptor. 5-HT is shorthand for serotonin, and an antagonist at the serotonin 5-HT2A receptors. So all this to say, it has both dopaminergic and serotonergic activity beyond just what you would find in something like Haldol or an SSRI. So it has the potential for a lot of different indications due to its broad spectrum of neurotransmitter activity. So it's FDA approved for the treatment of schizophrenia as well as bipolar 1 disorder. It's also most recently become FDA approved for adjunctive treatment for major depressive disorders. What are some of the benefits of this antipsychotic over some others? Well, we talked about the fact that there is a broad spectrum of indications. It also has a relatively favorable metabolic profile, meaning that it is slightly less likely to cause things like weight gain, blood sugar issues, cholesterol issues. There's also some evidence to show that it may have a pro-cognitive effect, meaning boosting cognitive function. And there's also some evidence to show that it improves people's social functioning as well. It does have a long half-life, which means that if you miss a dose here and there, you're not going to immediately notice the difference. There will still be maintained a steady state in your system. And they are also looking into possible indications for substance use treatment as well. That being said, I would still counsel patients about all the same possible side effects as with any other atypical or typical antipsychotic. So I break it into three categories. The first is going to be basically side effects that can happen with any psychotropic medication. These are things like dizziness, headache, stomach upset, drowsiness, insomnia, fatigue. And then the second cluster are going to be the metabolic side effects. It may cause an increase in appetite, weight gain, blood sugar issues, cholesterol issues. And for this reason, we do need to monitor annual metabolic screening labs. So we're going to check a complete blood count, a comprehensive metabolic panel, a hemoglobin A1C, which is the measure of your average blood sugar over the last 3 months, and a lipid panel every year. And then the last cluster of symptoms are the extrapyramidal symptoms. So these are much less likely with the atypical antipsychotics, including Cariprazine. However, that doesn't mean that there's zero risk of these. So these are things like more acute reactions like akathisia, which is a sense of internal restlessness, or a dystonic reaction, which is an uncontrolled sustained muscle contraction. And then there's the more long-term extrapyramidal symptoms, things like tardive dyskinesia, where you have repeated muscle movements that develop over time and they don't go away, or Parkinsonism, where you have a slowed gait, masked faces, tremor, and muscle rigidity. And because this medication has serotonin, we also have to counsel patients about the risk of serotonin syndrome, in addition to neuroleptic malignant syndrome, because it does have that D2 blockade. It is a possibility. We're also going to monitor for SI, and there is a black box warning against the use in older individuals with dementia, because just like with any atypical antipsychotic, there is an increased risk of mortality with the use of these medications in this population. And because of the serotonergic activity, as far as tapering off or discontinuing this type of medication, I would use the same hyperbolic taper approach, because theoretically there should be the same risk of withdrawal symptoms, both acute and protracted, than as with something like an SSRI because of that serotonin activity. And of course, I would answer any questions they might have, and then we would go forward making a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my comment, because I may have future courses or offerings or resources that I want to be able to share with you all, and I want to be able to do so directly. So if that's you, then send me a DM with your email, and I'll see you in the next one.